Welcome to Naspa Tonight. I'm your host, Josh Greenway. This is the YouTube live show that is all about Scrabble. We have got a packed lineup tonight. We're going to be talking with Joey the K Krafchick. We're going to talk with Jackson Smiley. We're going to talk with former NASC championship champion Will Anderson, and we've got a big interview with Doctors Mina N and Kene Mezue to talk about COVID and Scrabble and what the future holds. So I don't want to waste any more time other than to say thank you very much for tuning in. Thank you for watching. We haven't done one of these in quite a while, so we'll see how I do. Hopefully it's like getting back on a bike. But we haven't done an episode in certainly a number of months. So this is what we're doing. Let's go ahead and introduce my first guest. If you have watched... Oh, I see what we're doing. Okay. If you've watched Naspa Tonight before, you have definitely seen this character on the show. Let's give a warm welcome. Oh, hold on. Let's give a warm welcome to Joey the K Krafchick. Joey, how are you?
Hi, I'm great, and it's amazing how when I actually go live, it changes the whole camera view. I love it.
That's technology, my friend. So the reason that we're having you on tonight is because you are known as a odds maker. You like to set odds, especially when it comes to nationals. You're generally included in those like rotisserie, NASC. What do you call them? What do you call that thing?
Yeah, I mean, rotos.
Yeah, rotos. Yeah, exactly. So you're often involved in those things. And what I wanted to know is, do you currently have odds set for nationals? Nationals, in theory, would be coming up August 1 through 5. And NASPA has given themselves until May 31st to make a decision. So are you taking any action on...
Nope.
Go ahead. Go ahead.
Yeah, I'm not taking any action because, this just wasn't part of the equation. As tournaments approach, I pay attention to who signs up and I adjust it. It's just like one of those things that I like to do on the daily just to kind of goof off. And, I like numbers, whatever. I'm a nerd. You can make fun of me all you want.
What would be the odds right now?
Well, what I was saying was that as I go in and tweak things and look at stuff, you don't consider the odds that, this tournament's not even going to happen at all. So I think based on all the information we have, it's pretty obvious that the odds are close to zero, that we will actually have regular nationals on time. But I'm not, it's not there. We know some things, but there's not enough for me to actually take action on it. I think that would also be a little bit unethical, but I digress. But I hope there's nationals, I hope somehow that's able to happen, but I don't really see how that could happen because even though it seems like a few months from now is a long time, it's really not. So we just have to kind of keep aware that things just don't always fall into place.
Yeah, for sure. And there's no question. So I've been in on some of those NASPA meetings where they're talking about this. And obviously they're doing two things at once. They're currently planning for nationals in case something miraculous happens. They have been planning over the last couple of months just in case. But they've also started to take a look at contingency plans. So the question is, what does that look like going forward? Some ideas that have been talked about is doing something online. Doing something like a small invitational once small groups are allowed to gather, but it's really difficult to say at this point. It's like when you hear about what Major League Baseball is trying to do or what the NBA is trying to do. They keep putting out more and more plans about how they're going to put something together. So yeah, who knows what is going on with nationals. I did have one other thing that I wanted you to weigh in on. Michael Donegan posted this on Facebook saying, I've played 2,998 tournament games. I wonder if it'll get to 3,000 Joey, what kind of odds do you put on Michael Duncan getting to 3,000 career games?
Yeah, I mean, I think the consensus is that there will eventually be a vaccine. Maybe sooner rather than later would be nice, but no matter what, that's like the end of the road almost. I mean, unless I'm completely uninformed, but once there's a vaccine, I think everything, including Scrabble, will be able to resume. But I think we should talk about that more later with people that might actually know what they're talking about on that subject.
Yeah, exactly. I think that's a very good idea. Just so everybody knows, you may see opponents dressed in masks going forward. This is a great picture of Jason Broersma in a Hello Kitty mask. I also wanted to talk about something else with you, Joey. Give me 1 second. I wanted to talk about online play. So, can you give me a breakdown of what we've been seeing? Obviously, there were some really big online tournaments. The ones that Benji have been running have been, gathering lots of people. Super exciting. The high school championship that Will Anderson did. We'll talk with him about that. And lots of online club play. But I think you were going to talk about some of the other tournaments that had gone on online.
Yeah, so pretty much immediately once the quarantine started, a lot of people started offering a lot of different kinds of online tournaments. So we've seen a lot of different formats tried and pretty good participation. This is definitely the time to do something like that because most people aren't that inclined to play on ISC, at least under normal circumstances, because ISC is not a very good website. But a lot of people just play Scrabble, Facebook Scrabble, as a default, even though it's void. So there's really not a great online Scrabble tool right now. That's kind of the problem, and it's going to continue to be a problem if we've permanently shifted to we want to do things in general in society more online. Because with Scrabble, that's a big hurdle. So it definitely brings up a big question as to how we're going to handle this crossroad.
Absolutely. So, but kudos to everybody who's doing stuff online. I mean, obviously, keeping our community connected during this time when we can't be in person is a great thing to be doing. I wanted to talk about a couple of headlines with you, Joey. The first one, and we're going to call this breaking news. The first one is Scrabble Go just released something today that, quite frankly, I can't even believe it. I knew that this was coming, but number one, they're providing support for the NWL lexicon. And number two, they've created a whole mode, it seems, based on Scrabble tournament Scrabble players saying to them, I don't like these bells and whistles. So they've actually cut that part out. And now you can click a setting so that you'll just play Scrabble and you won't see any of that stuff. I can't believe it. I'm interested to hear. Have you played any Scrabble Go?
I haven't. I've heard a lot of the negative feedback from the tournament community, but I guess I go in and out of phases of whether I want to play or not. And for some reason this year, I just haven't had any desire to play or study. But I'm glad they worked out the bells and whistles because
That's incredible.
Someone's listening at least.
Yeah, we'll talk a little bit more about Scrabble Go with Will, but I want to cover two other pieces of breaking news, and in the category of good news that is happening in and around Scrabble.
Good news is good.
Good news is good. So here is, we've got so we just did breaking news. Let's see if we can set this up so it says exclusive. I don't know how exclusive this is, but we had some little bundles of joy added to our Scrabble community. Number one, I spoke with Mel Jordan today. Here she is looking beautiful with baby Casper. Casper was born on April 28th, so just over 2 weeks ago at 6 pounds, 8 ounces. Casper Jordan Mermelstein. How cute is this baby, Joey?
Incredibly cute, and I think it's very funny that his name is Casper because I used to actually be called Casper sometimes because I'm so pale.
Oh, damn. Okay, well, there we go.
Just
Well,
for the record.
big shout out to Mel Jordan. Mel is awesome, and I'm sure Casper is going to be quite the little Scrabble player. Now, our second bundle of joy comes from, I believe, the West Coast, but maybe you would know better. We have baby Mars Bloom, who was born to Ine Bloom. Oh, wait a minute. That's not the baby. Just a sec.
That's the warm-up picture.
That's the warm-up picture. There. Look at that baby there next to Travel Scrabble. Ine shares that Mars Bloom was born March the 21st, 8 pounds, 3 ounces, and she is currently preparing a book for him, an animated summary of the 2-letter words with definitions called The Terrible Twos. What do you think of that?
Well, you got to start with the basics. So once he can talk, those twos, I think they can start working on the twos at that point.
So I want to say thank you to both Mel and Ine for sharing those photos with us. And Joey, before you go, before I move to Will Anderson, so Will, you're coming up, FYI. I want to ask you, how are you doing? Are you staying safe? Where are you in the country? Well, your lower third says you're in Atlanta, Georgia, but tell us a little bit about what's going on with you.
Yeah, I'm in Atlanta because of the unforeseen circumstance going on globally right now. That kind of shifted my plans temporarily, so I'm here as opposed to elsewhere. So that's the basic summary, not to bore everybody. And there's no telling what's next.
Are you keeping safe?
I'm always safe. I know I don't have a mask on right now, but that was only because I thought that would not be good for the audio quality of this stream. So I am very safe. I wash my hands a lot. I've washed my hands a lot since I can remember. That's not a new thing. This whole thing everyone's going through is like, it's business as usual, So.
Okay. Well, listen, I'm glad you're keeping safe. I'm glad you're washing your hands. You're keeping that mask on. Those are good tips for everybody. The good news about tonight is everybody's coming in from home, so hopefully the safety of home. But now we are going to go to our next guest. So thanks very much, Joey. And hello to everybody in the comments. I do see some people in the comments, people throwing different things up there about EA apps and Scrabble Go and ISC. So there's a lot going on in the comments. Feel free, if you have any questions for anyone, to add to those comments. In the meantime, I'm going to bring on my next guest. You know this guy from his NASC championship, but now he is picking up steam as the newest Twitch star. Here he is, Will Anderson. Will, how are you?
I'm good. I'm glad to be here, Josh. Good to see you. Always happy to be back on the show, of course.
Fantastic.
Yes.
Now, there were a couple reasons that I wanted to talk to you tonight, so we're going to jump right into it. First of all, how are you? Are you keeping safe? Are you working from home? What is going on?
Yes, it's not been the hardest transition for me just because for the last few years I've been full-time remote working from home. So it's not a big transition for me in that regard. Allison is here. For her, she works at a school, so it's very different for her to be here all the time. But we're doing well. 3 cats doing well.
I was about to ask, how are the cats
who knows? Doing? A cat may come in and pop on the stream. You never know. But we're doing okay. It's not been as nice. It's not been as difficult of an adjustment as I imagine it is for a lot of people that have jobs that are in jeopardy, and
of course.
We're doing okay.
Yeah. So. Absolutely. I feel totally lucky that I am able to do remote work at this time, and I definitely have friends who have been furloughed or laid off or whatever. So this can definitely be a difficult time. Now, having said that, on a lighter note, how are the cats how are the cats dealing with you guys being around all the time? I guess they're used to you being around, but have they had to go through an adjustment?
So the biggest thing is I think I'm getting much more props from Allison on all that I do on a day-to-day basis to triage them. Like every day at lunchtime, I go down to the basement with toys and run them around until they take naps, and that lets me get a good afternoon of work in. And I think I'm getting more credit for the things that I've already been doing. And who doesn't love getting more credit? So that's been the biggest adjustment with respect to cats, I would say.
Okay, I want to get to you before we talk about your Twitch channel and sort of what your, where some of your efforts are going lately when it comes to Scrabble. I want to get I want to run a couple of topics past you and get your feeling on it. So you obviously have won a North American Scrabble Championship. If for some reason this year's, one of the priorities for Naspa when possible, and this is why Naspa runs a nationals every year, they want to name a national champion every year. It's an important priority because that's one of the ways that we build exposure to the game. It's one of our best sort of media opportunities. Right now, the odds do not look good that we are going to have nationals in Baltimore. But there are people who are suggesting other options. So those options might include doing something online. I don't know what that looks like exactly. Or the other thing is doing a much smaller invitational that, later in the fall when things start to open up, where there may be different rules for people from different states in terms of what their responsibilities are, but maybe a small invitational. What do you think when people talk about those things? And do you think, do you think someone who plays online could have, would they have an asterisk next to that championship no matter what? That's sort of the take that I'm looking for from you since you won one of these things.
Yeah, a lot of thoughts on that. So obviously, I will always vote in favor of more Scrabble than as opposed to less. So if that's the only way that an event can get off the ground is to sort of artificially limit the number of people that can attend, if it's between that and not having an event, I would surely favor doing it that way. But certainly my personal approach to nationals every year is more as a big convention and seeing all my friends. And, I have many more friends in Scrabble than just other people who might be selected to compete in that invitational. So it would certainly be disappointing to have an event like that. I almost, like I said, always prefer more Scrabble as opposed to less, but I really would consider waiting until it could be something more like what we recognize to be nationals. And that's as somebody who I would probably benefit from an invitational format,
right?
Just by winnowing the field down a bit. And it might be in my personal interest if we were going to try to crown a champion that way, but I think I would just as soon wait until we can do it the real way. As for the online question, it's hard not to imagine there being an asterisk after that, just because it is so different. The feel of playing online, in addition to, quite frankly, there's just hurdles involving just verification of, ethical play and stuff that I think it can be worked out. I've heard proposals that, you could do an online tournament that had hubs and proctors, so people would be able to sort of play in a socially distanced way. But I think there's just enough differences between online play and in person that it's hard not to imagine an asterisk after an event like that. But again, I'm all for, I would love to see as many people as I can. So it's just a tricky question. I hope I didn't dodge it too much.
No, I appreciate your thoughts on it. I think it is difficult. I would think an interesting situation would be to do something think about what Michael Tang was trying to do with I think calling it the Alchemist Challenge or something, where it was head to head between Ganesh and Nigel, and didn't come to fruition this year. But doing something like that is an interesting way of, maybe working around some of that stuff. But certainly, I hope that we have another national soon, whether that's in later in 2020 or in 2021, maybe more likely. But I appreciate your thoughts on that. The other thing I wanted to get thoughts from you on is what is going on with Scrabble Go. Now, you've done some work for Scrabble Go. You've made some videos with some tutorials and stuff like that. I cannot believe how engaged these guys have been with our community, and I can't believe that they've created a non-frills version of their software for what seems like the feedback from our community. It's pretty incredible. Can you talk at all about what your experience has been with Scrabble Go and just what you think of these changes that they're making?
Yes. So I imagine when you say you're surprised that they did that, is that they sort of intentionally made changes that make it more difficult for them to sort of do their monetization things that they're doing with their gems and stuff. They've literally said, all right, if you guys are that upset, we're going to take that away. We can't really make any money from you with ads and stuff and gems, enticing you to do gems, which it's hard not to appreciate that, I think the app has been sort of successful from a commercial standpoint, despite the uproar that it has spawned in our community. But that was surprising to me too. But I have been, as you alluded to, working with them for a little while. I've done videos with them. I just recently did a stream where they had on their Instagram that people could challenge me on Scrabble Go, and I played just all comers for like an hour. And some of those people I'm still playing. Yeah, some of those people I'm still playing, which maybe I need to lock my account down a little bit, change my name, because I do get a lot of requests, but that's okay. That was a lot of fun. But yeah, I guess my stance on the app is there are subjective things about the app that some people are going to like and some people aren't. I think there are objective issues with the design and the clunkiness of the original interface, and the fact that, objectively speaking, there are people that have very different expectations of their Scrabble experience, and I really hesitate to tell anybody that's upset with the app that they're wrong for being upset. But from where I sit, I don't mind the pastel colors, and I don't mind the tile sets to collect. It reminds me of something that I would have been really into when I was a little bit younger, and that maybe is the target audience that they're hoping to skew towards. So
yes,
I've enjoyed it. It's not a perfect app, but as you said, they are listening, and it feels like they are committed to creating an app that is at least palatable to the tournament community. So, full disclosure, as you said, I have done stuff for them. So it's, the optics of me coming on here and blasting the app are not good from that standpoint. But I actually really do believe that it's, it runs smoothly. I like the graphics. I wish there are a couple little things I would love. I wish the mini games would be available all the time, not just as tournaments. A couple other changes I would love to see made, but who knows, if we just express that, that desire to see the changes enough, they seem responsive enough to maybe make those changes. So
anyway.
Yeah.
I often get accused of being paid by these guys. I have not received one penny.
I'm the real deal. So
that's right. Exactly.
Anybody unhappy with Josh, take it out on me for being a paid shill. I am the actual paid shill.
Somebody in comments, by the way, just mentioned that they have over 35,000 gems without paying a penny to them. I have 7,000 in the same
That is impressive.
Boat, but 35,000 is incredible.
I think I have 4,000. 35,000. Good job.
I think we're too much in the weeds here. I want to talk about your Twitch channel now. So, first of all, let's talk about what Twitch is. So, Twitch is, why don't you give us a very brief description of what Twitch, the platform, is and what you do on there?
Yeah, so it's just a gaming platform where people can sort of broadcast themselves playing games in an entertaining way. It's kind of like a do-it-yourself television network for people that are playing computer games and games on basically any computer-based game that is interesting to people. You can go on Twitch and share your computer screen using software that helps you broadcast, and you can basically start your own TV show. That's basically what it's.
And what is your show, and why should people watch it?
Well, just first I will shout out Ben Schoenbrunn for being sort of the trailblazer in this area and inspiring me to feel like I might have contributions in this area. But basically, my show is originally the idea was I thought it would be interesting to watch, a high-ranked word game player. And that goes for Scrabble and Boggle and other word games that I've played. I thought it would be fun for people to just watch me play and play along and do sort of interactive games with my viewers. But in actual fact, it turns out that I think the value proposition of my stream is watching me humiliate myself in various ways and lose to video game AIs that are clearly should be inferior to me, but yet I lose to them anyway. And just having me sort of make a fool out of myself for public consumption. That's how it feels to me sometimes. But I think it's a little bit of both. It works out being like sometimes I do good things that are fun to watch. Other times I do silly things that are fun to laugh at me. And I can laugh at myself, so I really don't mind it. So it's kind of a variety word game show. A little bit of Scrabble, a little bit of Boggle, and video games, old Nintendo games and such.
I can't believe how many word games are on there. When I see you playing some of this stuff, it's incredible. Just to show people, I want to know how well this is going to work. This is your stream from Scrabble Go.
Yeah, I alluded to this. Could have played with ads, so...
This is awesome that this was on their Instagram. That's incredible.
Let's see. I guess I probably have to find the longest possible thing through
over
the
myself.
A of Wawa.
This is eerie. Two of me on the stream at once. So, yes.
Guess I'll do this.
Who knows if that was a good play? Probably not.
I have no idea.
There we go. I'm going to pause that and bring us back to full here. So, number one. I just had it up. Here, let me bring it back up here. But I want to make sure that everybody has this link, twitch.tv/Wanderer15. Well, how else could people find this stream? If they looked you up on Facebook, are there, posts where you tell people where to go? Well, What's the best way to find you?
I definitely, so if ever I have any aspirations of sort of taking this beyond our community and into the broader sphere of people watching Twitch, I definitely need to do a little bit more, get on more social channels. Right now, it's I would say my audience is a pretty faithful subset of the Scrabble community. So basically, if you're my Facebook friend, I usually try to drop a quick post. If I have a really interesting piece of content that I want to plug, I will post it in the Naspa group, which has a much bigger audience than just my friends page. But I'm not a huge self-promoter. So like I said, if ever I want to, push this thing as far as it can go, I need to get over that and start getting on more platforms and promoting harder.
Well, let me push you here for a second. If you like Scrabble, if you like Will Anderson, you should definitely check out his Twitch channel. He streams there on a very regular basis, streams all kinds of word games. There's lots of stuff there that you will enjoy. If you've never used Twitch before, a good point to make here is that if you have an Amazon Prime account, you have a way of subscribing to Will's channel, which would help him out. And I just think it's awesome what you're doing. The very last point, and then we're going to sign off because we need to go to our feature interview tonight, is you recently streamed the high school championship. For those that got to saw it, it was really an excellent production. That was spearheaded by Will. I think, just me personally, I think Will is doing some of the most innovative stuff when it comes to broadcast technology, when it comes to all this Scrabble content. And I'm really excited that we're going to be taking some of those games and putting them on the Naspa YouTube page. Can you sum up briefly for us what it was like to be involved with that high school broadcast?
Yes. So basically, I was approached by Stefan Fatsis about what capability I would have to do sort of a live broadcast of the, I think he called it the Quasco Quarantined High School Championship. And basically, I went far more overboard with it than I'm sure he or anybody else expected in terms of getting the graphics and making a whole new interface that doesn't really resemble my basic streaming interface, just because I've always relished the opportunity. I've never had the skills before to do anything like that until I started fiddling around with the software for streaming. So once I got a little bit of a skill set there, I decided let's go for it and try to do something that has some elements that I've always wanted to see but haven't seen that often. Like I had the telestrator effect where I could draw on the board and show people different spots that I was referring to in my commentary. So it was a lot of fun for me to do. And like I said, I think I over-delivered for Stefan. But we have another tournament coming up at the end of the month, which is going to be for the middle schoolers.
Fantastic.
And once I have more information on that, I think there is some on Cross Tables, but that's going to be on the stream link, my stream that you see on screen right now as well. So if you enjoyed that high school tournament, stay tuned. There's going to be more where that came from at the end of the month.
Fantastic. Will, I want to thank you so much for joining us here tonight, for weighing in on a few different issues, for doing all the great work that you're doing on Twitch when it comes to Scrabble content. This is the sort of thing that helps keep us together in times like these when there are no tournaments. So I encourage everyone to check out Will's Twitch channel. Now, here's what we're going to do next, everybody. We are going to go to an interview with young Jackson Smiley. You remember Jackson, Will.
Vaguely.
We're going to talk with Jackson for about 3 minutes, and then we're going to bring on Dr. Mina and Dr. Kene, and we're going to talk about Scrabble in the age of COVID and all that kind of stuff. So stick with us. This video is about 3 to 4 minutes long. Okay, here we go. Thanks, Will. Talk to you soon.
Thanks, Josh.
All right, I am joined by the one and only Jackson Smiley. Jackson, how are you?
Doing pretty well. How about you?
I am fantastic. Now, given this time where everybody is stuck at home, what have you been doing over the past couple of months?
Well, I mean, not that much, mostly. I've been cooking a lot. I've been walking a lot. I also finished my degree, so I guess that was probably what I should have
Right,
said.
that's a big deal. What did you get your degree in?
My degree is in cognitive science, mainly, plus a few other drips and drabs. I rewarded myself with a new bike that people may have seen on Facebook, and then it promptly got stolen 2 weeks later.
Oh, no. So, was it locked up?
It was locked up in the same place I've been locking my old bike all year. But I used my old tattered seat to make it less attractive.
Oh.
I also got the black color instead of the nice neon green color. I feel like I was doing all the right things, but then, yeah, so quickly got stolen. But,
crazy. Yeah. Tell me about the high school tournament, the stream that you were part of. I saw you on there with Will Anderson and Mac Miller and Josh Sokol. You guys did a fantastic job.
Thank you. It was good. Also, Stefan Fatsis was organizing it, and he did a great job organizing. It was nice to have this, because we had it last year, and it was a great time in Philly, but I mean, obviously we can't do that with COVID, but it was still pretty good online, and it was fun to commentate. Just like last year, we saw a lot of really exciting games, which we were really fortunate to see, especially everyone was noting Chloe's crazy comebacks, which were awesome to watch. And then, yeah, congrats to Thomas Shumby for winning. Came out of nowhere at the end, so it was pretty good. It still felt pretty real, especially with the commentary and Will's nice setup.
Yeah, Will did a fantastic job with the stream. Huge kudos to him and you guys on commentary. It was great, and we're going to be adding those games to the Naspa YouTube channel, which is exciting. The other thing I wanted to ask you about is you are now going back for another round of tree planting. Is that true?
It is true. And I know there may not be nationals this year, and so it makes the decision a bit easier. I'm excited to go back. It was a bit of a tough decision. Like, even though the experience was amazing last year, it's still drudgery. It's still super hard. There's still bugs that make you go literally insane. So that made it a bit tough to decide to go back. But even with COVID going on, we are going to have to social distance for a while up in the woods. It's going to be
What is the plan for that? Because that's what I'm concerned about. I mean, I was a vocal opponent of you going tree planting last year. That mostly had to do with what it was going to do to your nationals performance. But now I'm just worried about your physical health and safety. So what do you think that's going to look like when you get up there?
So yeah, I mean, they obviously haven't dealt with this before, so it's going to be new for the bosses as well. They're saying we're going to have to socially distance from everyone for the first 20 days at least, and then they might loosen restrictions. We're going to spend all the time there. They're going to have minimal Wi-Fi, like once every 5 days we can use just to like text loved ones. But it's going to be intense, like for real. I think it'll be nice to just get out, especially when I was living in a basement for all these months of isolation. It was like, yeah, it's time to get into the woods.
Well, I wish you luck on the tree planting and hope that you stay safe and hope that you guys figure out a way of socially distancing yourself. The whole turning on Wi-Fi once every 5 days sounds like a horror movie to me personally, but I think that's what you were dealing with last year, right?
It was, yeah. It's because like I know myself well enough. Everyone's tried to like delete Facebook or whatever for a few days, but then you invariably go back. But this is the only way to really force yourself to get a bit of a reflective break. So I'm excited for that.
Well, there you go. Well, thank you for joining me here on Naspa tonight, giving us an update as to what's going on with you.
Thank you. And yeah, have a good summer. Stay safe, everybody.
And there we are. That was an interview with Jackson Smiley. So thanks to Jackson for that. He is not live because he is in Thunder Bay. He is on his way out to tree planting, which is very exciting. But I want to introduce my very special guests. I hope this is not too informal, but Doctors Mina and Kene, how are you guys? Thanks very much for joining.
Hi, Josh.
I thought what would be good is rather than me try to kind of mangle your medical backgrounds and sort of what you guys work on, is I thought maybe we could start if you could give us a little bit about, kind of what your practice is, what kind of medicine you practice, whether you've seen, I don't want to go too deep into this topic, but maybe tell me where you work, like whether you work in a hospital or an office or whatever. But why don't we start with you, Mina, if you can give us a little background on what you do. Uh-oh, you are muted. I do not know why you are muted.
It was so that
there
you wouldn't hear me. It was so that you wouldn't hear me making noise during the earlier part of the episode. Thank you for bringing that to my attention. So I did say hello, but it wasn't heard. Okay, hello everyone. Thank you, Josh, for having us here. So I'm Mina N. I'm an ear, nose, and throat surgeon. Otolaryngologist is the formal Greek term. So that means after medical school, I did a 5-year residency in ear, nose, and throat surgery. On top of that, I did a 2.5-year fellowship in head and neck cancer surgery and worked for a few years for the VA system in Florida. And then I took my current job. So I work for Rutgers, New Jersey Medical School. And I work at 2 different hospitals. The primary one is called Bergen Newbridge Medical Center. It is the largest hospital in New Jersey, and it is the safety net county hospital for Bergen County, which is a heavily populated county in the northeast corner of New Jersey, right next to New York. A lot of New York commuters live there. And then, so I'm mostly based there. I also work at University Hospital, which is a tertiary teaching hospital, also a safety net hospital based in Newark. And both hospitals take care of a lot of underprivileged patients, which is part of why I work there. That's a passion of mine. So before this, I was doing things like seeing patients in the office and doing surgeries like taking out tonsils or fixing deviated septums and removing neck masses and that sort of thing. Since COVID, things have dramatically changed. So elective surgeries are on hold statewide by governor's orders. So I haven't operated since mid-March. And our clinics are also on hold. So people coming into the office for a drippy nose or a scratchy throat, those appointments don't exist right now. If there's something very urgent, we might see them over telehealth, over webcam. But I've actually, because of the decreased demand for my specialty, I've been reassigned. So since the beginning of April, I've actually been a COVID doctor full time.
Wow.
So what that means is I've been seeing people who are sick with COVID or suspected COVID who are not yet sick enough to be hospitalized. And so this is most people out there who are at home, with the symptoms. And so what I do is I see people coming in with symptoms. I talk to them over webcam. So I'm at my home, they're at theirs. And I order their testing, and then I follow up with the positive ones to make sure they're getting better instead of worse. And now that we've rolled out the antibody test, I'm also dealing with asymptomatic people in the community who want the antibody test, as well as the saliva test, which was developed at Rutgers and which we are rolling out for asymptomatic testing of community members. So in a way, I'm not on the front lines because I'm not, all suited up and putting my life at risk like many doctors are. But it is the front lines in another sense, in that I'm playing a very important role with seeing people in the community and getting them tested.
Awesome. And that definitely sounds pretty amazing that is going on remotely. Dr. Kene, can you talk a little bit about what your background is, what kind of medicine you practice, and kind of what life looks like for you today?
Yeah, thank you so much, Josh, for inviting me to this forum. My name is Kene, and I work as an internist. So my specialty is internal medicine, which is a really broad specialty. We are basically doctors for adults, and then there are different ways you can practice internal medicine. But the particular way I practice is I practice as a hospitalist. And so I only see patients who are in the hospital. I have colleagues who work in clinics and, they follow up patients in the clinic. And whenever a patient is sick, they come to the ER or they come to the doctor's office, they get into the hospital. I get to be the one to take them from the ER into the hospital, take care of them every day, and then get them discharged, get their follow-up set up. So basically that's what I've been doing for about 3 years. So I live in Grand Forks, North Dakota. I work in a community hospital here, and I really love it. I think mostly I like it because it's small. You can easily get stuff done. All my colleagues are very cordial and, have a great relationship. So that's, one of the reasons why I like working here. Unfortunately or fortunately, when COVID broke out, we are the front line. So it's basically hospitalists and the ER docs that basically face the onslaught. And it's kind of really weird. I also have a public health degree, public health background, because when I finished medical school, at some point I was thinking of going into a research career. And so I got a master's in public health and I was thinking of doing a PhD. And I really enjoyed epidemiology. So, that was kind of what I was doing a little bit before I came back to clinical medicine. And, we have outbreaks every time. I mean, many people don't realize it, but there was a big Ebola outbreak in the Congo last year. And, people don't really. So when the Wuhan thing started, we got the news. We didn't really think too much of it, to be honest. And if you go back, to all the YouTube videos from the January and February, you find that all our, CDC officials and our, and our top epidemiologists were telling us that, it's nothing to worry about. It's a small outbreak. And we shouldn't really be too scared of it. So we didn't really get worried. I think that when the whole thing hit home was when we saw what was coming out from Italy and Iran towards the end of February. And that's when we knew, a lot of us knew that, look, things were going to get bad, And then, yes, things really did get bad. But hopefully things are getting better now. So, we'll be glad to, answer any questions you have about COVID and how it also pertains to Scrabble.
Well, the first question that I had for the two of you, and number one, I have a great deal of respect for anybody who puts the kind of work into their careers, like the two of you. I think, like everyone, love doctors. I also love lawyers. I see a very similarity. Not everybody shares that feeling about lawyers, but I like anybody who really invests in what they're doing. So what I want to know is what does things, I'm going to start with Mina. What do things look like for you right now if you have to leave the house? What measures are you taking? And the reason I'm bringing this up is just so everybody can, hear what a day in the day in the life of a doctor, fielding telehealth calls from COVID patients, how you're protecting yourself.
Yeah, so as I said, all of my work with COVID patients is currently distanced, right? It's over telehealth, over the webcam. So I'm not getting suited up. Very rare occasions I have had to come in for emergencies. And for instance, I'm going to be taking call for a week at the end of May. So I anticipate coming in more then. So in that sort of situation, coming in for an emergency, I would be putting on scrubs that I could easily leave behind at the hospital and an N95 mask. And a face shield or goggles, depending on which is available. So that's what I would wear to see patients. But just leaving my house, right now I'm mainly just leaving the house to go on exercise walks or to go shopping, and I'm just wearing a regular mask for that. We ordered some fabric masks online, and that's all that's needed. But it is a mandate by the county executive that you can't even go out in the park right now without a mask, and a homemade mask is fine.
There we go. Incredible. Dr. Kene, what about you? What does it look like when you go to the grocery store?
Oh yeah, so I think it's very important for everyone to wear a mask. For me particularly, because I'm young, there's a big possibility I actually have COVID. I work in a hospital. I see COVID patients every day. So I need to be even more worried about giving it to people because as we know that there's a lot of people who can be asymptomatic and but they can still transmit the disease. So yes, I try to wear a mask, try to wash my hands very frequently. And even though it's very hard, try not to touch your face. It's a big thing, trying to keep your hands to yourself, But to be honest, it's as we get more information, I think I'm getting less scared of the disease, I think more because of all the data we're now getting. And I think that's very helpful in assuaging my fears. I mean, it doesn't mean that I'm not taking precautions anymore, but it just means, I just touched my face, sorry. But it just means, but it just means that, as we get more data, we can, know that it's not the end of the world. I have a colleague who, he unfortunately had a contact with, COVID patient without wearing PPE because, sometimes we don't get to know who has COVID, who doesn't have. And, at first he was really, really scared and weirded out, because he has to go in quarantine. But, I was able to show him the data. Look, if you're young, the chances of you getting severe disease is very, very low. So that's another thing that we're trying to see if we can get people to understand that, it's not as bad as we initially thought. And it's actually going to get better. So yeah.
I think that points to certainly when I see the two of you kind of post things on Facebook, I tend to see a little bit of a difference. So I want to go to Mina here for a second. Now, Mina, one of the things that you were involved in when Scrabble tournaments were first starting to shut down was you put together a petition that was signed by a number of doctors and other Scrabble players, I think by Dr. Kene as well. Can you tell us a little bit about what that experience was like and, kind of tell us the story of the petition?
Yeah, so to put a personal view on it here, I didn't take COVID as seriously as I should have at first. And, back when it was confined to China, I confess I should have been more concerned at the time. I should have seen ahead of time that this was going to spread around the world, given that we live in this global society with so much international travel. But as Kene pointed out, it only started to hit home later. And then once it was hitting home for me, then my feeling was that people weren't taking it seriously enough. And one thing that's bothered me from the beginning is sort of this use of the word fear, as if to say, if you're afraid, why don't you just stay home? Or, you shouldn't be so afraid. And for me, it's about being prudent and wise and doing what's best for the public health and for vulnerable people, especially in light of how much asymptomatic transmission there is. And early on, I felt like the CDC was behind the ball, and the information that we have now only came very slowly. I mean, for instance, the idea that the virus could be spread by speaking or singing was not made clear at first. At first, they said it's only coughing and sneezing, and then there's that choir in the Seattle area where there was a choir practice, and a huge percentage of the choir got it. And there was that conference in Boston where I presume people weren't going around sneezing in each other's faces, but it spread like wildfire at this Biogen conference in Boston, and only bits and pieces sort of started to turn the tide. And so with my petition, I was trying to basically I was frustrated that there were still so many Scrabble tournaments going on as of early to mid-March, which I thought was inappropriate. And I felt that it was incumbent on Naspa as the sanctioning body to display a position of leadership. I mean, you can't prevent people from getting together, but at least you can refuse to sanction it and say that this is not what you should be doing now. And it took a while to get NASPA to reach that stance. And so tournaments kept happening, and so I was able to get the petition together, and Stefan Fatsis very kindly wrote up my petition in a Slate article, put that on Slate, and then Hasbro saw the article, and that's what finally, once all that started happening, that's when we finally started to crack down on sanctioned tournaments and club activity. So yeah, so that's what I've been pushing for, and that's with my Facebook posts and then with the petition early on, was just to get more people to take it seriously. With regards to Kene's point about being less scared over time, I think that there are many aspects of this virus and this illness that we're still uncovering. And one point that a doctor pointed out is that deaths from the respiratory sequelae of the virus are not the only morbidity. There's also the clots and the strokes. There's also the kidney damage. There's the pulmonary damage that you can sustain even after you get off the ventilator and go home. There's neurologic sequelae. So there's all kinds of, and right now there's this pediatric multisystem inflammatory syndrome that is only now coming to light in New York. At first they said, oh, kids don't get COVID, it's fine. Now we see dozens of children with COVID have this very severe issue that looks a little bit like Kawasaki disease. And so I think that there's more information coming out, and we shouldn't let our guard down, I guess is what I want to say. So it's not about it's not about fear. I'm not saying you should go be crippled by anxiety, but just to be prudent and to keep looking at the information, because there is a lot that's changing. My view might also be colored by the fact that I'm pretty much at the epicenter. I mean, I'm in the suburbs of New York City. We have tens of thousands of deaths from the disease. And although deaths have decreased in New York, they haven't really started to decrease in New Jersey yet.
Gotcha. So, and Dr. Kene, we'll come back to you. But Dr. Mina, I wanted to touch base on one thing when it came to Naspa, and I'm curious in regards to sort of what your thoughts are policy-wise. I mean, obviously, I do a lot of work with Naspa and work very closely with the executive committee and stuff like that. I guess my feeling is, ultimately, your concerns were obviously proven right. All tournaments needed to be shut down. I think the position of Naspa coming back, and I'm just curious to know your take on this, was, as Naspa, the organization doesn't necessarily have access to kind of medical resources, medical experts, staff, that kind of stuff. And they were trying to go with overall government kind of communications or government policy that was probably too late to react. What are your thoughts kind of hearing that? Do you think NASPA was dragging their feet, or do you think NASPA was in a tough position, or both? I
can understand what they're arguing, which is that, so John Chu said that, conditions are very different in different parts of North America. Conditions in North Dakota are very different than conditions in New Jersey and so forth, and he didn't feel it was right for him to impose some sort of blanket dictum over the entirety of North America, United States and Canada, when the conditions were so variable. And so I can understand that he said, follow local governments and local health agencies. So that's, in his defense, I mean, that's reasonable, totally reasonable. But on the other hand, if you look at, say, MLB, so Major League Baseball, National Hockey League, National Basketball Associations, National Football League, and so forth, these are organizations that said, like, we're suspending the entire season. Doesn't matter which part of the country you're in, it's done. And so I think there is a position for a large coast-to-coast organization to take that kind of leadership stance. So that's what I was pushing for.
Cool. Thanks for clarifying. And obviously, that's where we got to after a certain amount of time, and obviously that was the correct decision for sure. So, Dr. Kene, let's talk now about what I'm going to go to you on this first, and then I'm going to come back to Dr. Mina. But what are your thoughts about what Scrabble could look like later this year, 2021? Any thoughts on sort of what is there a stepped approach to opening Scrabble? Is it, I mean, it's maybe very well be too early to talk about it, but I'm curious to know what your thoughts about kind of timescale and what opening up could look like.
All right. I first of all, I want to say thank you a lot to Mina, because she did a great job. This was early March. I can tell you that at that point, a lot of people still thought it was like the flu. And, Mina and Dr. Cheryl Tyler and Marsha Gillis, they were all trying to let people know on Facebook that, look, this is not the flu. This is really bad. And Mina was very brave in saying, look, we have to tell Naspa exec that, look, you got to postpone tournaments right now. Because a lot of directors were still hoping to do their tournaments. And I really want to say thanks to her that she did that. She literally saved lives, because that was a period where we didn't have testing in the country. So a lot of people had the disease, but we didn't know whether they had it or not. So you couldn't really contact trace. You couldn't really stop people from spreading it. And that was a great thing she did. I also want to say that she did it before the NBA ban. The NBA, I just checked my phone now. The NBA ban was sort of like some days after. Because let me not lie, the day America took this thing serious was just after that NBA ban. Before the NBA ban, people did not take this thing serious. And then, I think 4 NBA players got it. They stopped the game on the court. It was ridiculous, And that was when America sat up. And, and then that's how, that was when everything started happening. Mina did a great job. Now, your question is about the issue of what will Scrabble look like. Now, like I told you, I have an epidemiologic background, and I love to look at data. And I'm not, I like to be very, very factual with you. I come from Nigeria, right? That's where I went to med school. In Nigeria, I think it was an estimate of about 300 million people get malaria every year. 300 million. A million kids die of malaria. These are the realities we live with in the world. Infectious disease is a part of being alive. What do we do as a society is we try and mitigate the risk. We try and reduce the risk of disease. Everybody keeps talking about the vaccine. My friend Joey, at the beginning of the show said, well, he hopes the vaccine comes in next year and then we can beat the disease. It doesn't work that easy, The recent Ebola vaccine works, but it took 5 years to make it. And that's the fastest we got a vaccine, That's the fastest we got a vaccine, 5 years. I'm not someone that likes half measures. I believe, there was a vaccine for this virus called RSV, which causes a really bad inflammatory disease in kids. And that version of the vaccine actually made people sick. They made the vaccine, they worked in the lab, they worked in the animal models, they tried it on humans, and it actually made people more sick. So the idea is you really have to be thorough. It takes time. Science takes time. It takes work. So I'm not one of those that believe a vaccine is coming to save us. No. I think that a combination of healthy practices and basically changing the way we live is basically going to be the answer in the long run. And I think that's what's going to happen, And, the idea of when is Scrabble going to come back to normal? I made a joke on one of the Facebook posts saying, when the strip clubs open up again. At some point, life is going to get back to normal. People are going to be able to take risks. And the fear is going to go away. That's the idea. But there are some populations that are still going to be high risk. And like I said, you could go to the CDC website. They have a really good, they have a really well-organized website that can give you all the data about who's at risk, who's not at risk. But you find that if you're young, if you're less than 40, and you're not obese or you have comorbidities, your risk of being sick from the virus is of the order of magnitude of 0.1%. Your risk of dying from the virus is of the magnitude of 0.01%. So, I mean, there are some people, I think it was Professor Ioannidis. There's this guy called Professor Ioannidis, Stanford professor. He's one of the most respected authorities in statistical epidemiology, And, he said, look, commuting from your house to work every day and having a road traffic accident is the same risk of being less than 40 and getting this virus and dying from it. So, he's trying to tell people that, look, there are certain people that don't have a big risk of dying from the virus. At the same time, there are people that have an astoundingly large risk of getting really sick and dying. And that is the elderly, people with, a compromised immune system, people with a lot of comorbidities. And so for those people, they might not get to play Scrabble the way we play. That's the reality, And everybody has to decide what risk they want to take. I have patients who I tell, don't smoke, but they're 90. And they're like, I'm going to die anyway, so I will smoke. And I'm like, okay, I agree. I see your point, and I believe in liberty. I think people, it's one of the wonderful things about living in America is that people tend to be free. And they tend to make decisions for themselves. The problem, however, is that, you can't make a decision that affects someone else's health. And that's where public health comes in, because you can't say, okay, I want to get the corona and I want to get it and I don't care about it. But as long as you have that potential to infect someone else, that's when we have to pass laws to say, no, you can't do that. So basically what I'm just trying to say is that my opinion about when we're going to start Scrabble is when we've gotten the infection rate down, hospitalization rates are down, and basically, most societies have said, okay, well, we're now in phase 4. So if you go to like the New York State website, they have like a whole opening plan. It's really elaborate. They have phases 1, 2, 3, 4. I believe Scrabble will be back when, most places are in phase 4. And that's when arts and sciences are open again. So they start with things like business, construction, then retail. And then the last stage is when we have to do things like arts and entertainment, But the reality, and I think you alluded to it earlier, or I think Mina alluded to it earlier, is that societies are going to be different. Everybody's going to be on a different timetable. And so the question is, can I have Scrabble in North Dakota, even though I'm the only player here anyway? But can we have Scrabble in some places and not have it in other places? Can we have it in, say, can we have a tournament in a smaller area where we know that we're in phase 4 or we're in phase 3? And then some other area where they're still in some, maybe like phase 2, they can't have it there. That's a possibility. But that, again, is going to be something that, I think the executives have to discuss. And, I think at the end of the day, it's basically what society sees as a risk that will decide when Scrabble will be normal.
Gotcha. Thank you for that. And Mina, Kene mentions infection rate. Is that the key metric for us to be looking at going forward? Are there other metrics? Like, how do you think an organization like Naspa, or more broadly than that, how we should be making those kinds of decisions?
Yeah, so I agree that infection rate is an important metric. The problem is we haven't been able to know the infection rates until now because testing is so behind, woefully behind. So right now, and even more so in the New York, New Jersey area, so much of the infection, so much of this disease has spread through routes that nobody has traced, through asymptomatic carriers, and you just have no idea. So the metric you should not pay attention to is the case counts. From the start, that has meant nothing to me. Like cases tripled in X state, or cases are now 2,000. That means nothing. You see 2,000, it could be 20,000. You have no idea. So infection rate, like R0, like how many people a sick person is infecting on average, like that is something to look at. But all those numbers will become more knowable once we have much more robust testing. And that's something we're only starting to see. I know that we're still very behind on getting federal help and resources to the states to ramp these up. I mean, in New Jersey, for instance, they're talking about hiring 1,000 contact tracers, and they want to get up to doing 20,000 tests a day, and so on and so forth. And we have this new testing method now developed at Rutgers University, which is the saliva test. Is easier to do with less PPE than the swab test because you don't need a person to take your saliva for you. You can just collect the sample yourself. So that's still all in the works right now. I mean, I completely agree with what Kene said about phase 4. I mean, I strongly believe Scrabble is a phase 4 activity. It is non-essential. It is not important to the economy. I get its benefits towards mental and emotional health, of course, but it's just so incredibly contagious. If you compare Scrabble to other leisure activities, like going to the movies, it is so much more contagious. The movies, you're keeping to yourself. Your hand is in your own bag of popcorn, right? In Scrabble, you're constantly dipping into this bag, and then you go to a different table and you dip into that bag over and over and over. And it's pretty much impossible that you haven't touched your face at some point, even if you are trying to wash your hands between every game, which are you really going to be that diligent? It's easy to slip up and so forth. So because it's unnecessary, because it's so highly contagious, I definitely think it's a phase 4 activity. I do agree that once, for instance, North Dakota is in phase 4, it would make sense to allow a local Scrabble tournament there. But keep in mind, you should not be allowing someone to fly in from New York to that tournament. I mean, they're going to be bringing the virus, right? So I think these larger tournaments where a lot of people are flying in, such as nationals, are not going to be happening for a long time. I really believe NASC needs to be canceled for this year.
Mm-hmm. Gotcha. So and I get the feeling that is the way we're headed. So I want to thank both of you for all the great information that you provided. I want to give you each, there are two things that I want to do. One, I want to give you each a chance to make kind of any kind of final points, anything that you think we haven't covered. I'd love to hear about that. And then we're also going to take just a couple of quick minutes at the end of the episode to talk to Mina about her amazing Jeopardy appearance. So we're going to get to that in just a second. Dr. Kene, any final points from you? Anything that people should know? Do you think we've covered it all? What do you think?
Well, I want to give people hope, basically. I want to say, look, the worst is behind us. I think I'm more scared about the fact that things are going to get so much better that we're going to forget how bad it was. And then in the fall and the next winter, say something around October, November, then we'll get a second wave, because that has a good chance of happening. But things are going to get better so fast that we're going to forget how bad this stuff was. Because when you look at the data from the CDC website, hospitalizations are way down. I mean, hospitalizations are so down that hospitals are laying off workers. And that tells you that there is no disease in a lot of places anymore. And that's the reality, I also want to point people to places like the state of Georgia. I criticized them. Even the president criticized Georgia for opening so hard, so fast 2 weeks ago. And if you look at their data, hospitalizations are way down in Georgia. And again, it points to the fact that these viruses are respiratory viruses. They need a certain type of humidity and temperature to spread. And once the weather warms up, it makes it harder for them to spread. So things are going to get better very quickly. But the problem, however, is that, when it gets cold again, we might be seeing another flash of the virus. However, I'm very optimistic also that we have very, very smart people working on this now. We have really good testing now. So I really think that when it comes again, we're going to be ready. But I would really want to appeal to anyone, our demographic in the Scrabble community has a lot of vulnerable people, and I really want to appeal to, anyone, if you are, if you're older than 60, older than 50, if you have hypertension, just even hypertension alone is a big risk factor. So if you have any comorbidities, I would say, please, take this thing very seriously. Wash your hands, wear a mask, restrict your movement, and stay safe. I think that's the most important thing. But again, I will tell you that there's not going to be a magic bullet, that's going to solve this issue. It's going to be just, old school public health, and just being careful that's going to help.
Well, thank you so much. Dr. Mina, anything to add or rebut there? Give us your final thoughts.
Yeah, I thought that was really good. I agree with Kene that the vaccine is not this magic bullet, this savior that we should wait for. For one, nobody has ever made a vaccine for any coronavirus. And for another, even if we had a vaccine, that doesn't mean that we would have anywhere close to 100% of people getting vaccinated. Look, we've had flu vaccines every year, and there's so many people who don't get the flu shot. So I agree that public health measures are going to be a big weapon against the disease. I'm a little more pessimistic than Kene about the impact of the weather, and we can see how it pans out. I just know that countries like Brazil, Australia, Iran, where it was warm, had plenty of spread. But we'll see what happens. I'm personally quite concerned about a second wave. With the Spanish influenza in 1918, the second wave actually killed more people than the first wave. And just because New York is done for now doesn't mean that the same thing couldn't happen in Houston or Miami or Atlanta or somewhere else. So I guess my parting thought is be vigilant, be patient with not wanting to go back to normal right away. It's not going to be normal again. This is sort of like 9/11. There's going to be a new normal. I wanted to put in a plug for online Scrabble. I really appreciate the people who have been keeping our community connected and playing Scrabble during this time, such as Judy Cole, who has been putting in lots of time and energy running online tournaments several times a week that are getting bigger and bigger, and other directors too. I know lots of clubs are meeting online, and I think that's really terrific. There is a team right now composed of Cesar Del Solar, Jesse Day, and Conrad Bassett-Bouchard, who are working on a replacement to ISC because of the many inadequacies with ISC, suspicions about its drawing algorithm, the ugliness of the interface, and so forth. So this team is currently meeting on a weekly basis and putting a lot of their free time into programming a better version of ISC that's going to have integration with an analog to Quackle, built right in. And so unfortunately this won't be done in time for nationals, but it is on the way. So just keep an eye out.
Absolutely, and I'm definitely interested in finding some time to talk with Cesar about that. So I want to thank both of you for your expertise and your passion and your work and all that kind of stuff. Dr. Kene, we're going to leave you behind at this point, and we're going to talk about Jeopardy. So thanks very much, man, and hopefully we'll get to talk again soon.
Yep, thank you very much, Josh. I appreciate it.
All right. Now, let's talk about Jeopardy. I realized I hadn't put together any pictures, so I grabbed this from your Facebook while we were talking there. I just want to say, I don't know where we are with spoilers with this thing. Like, Jeopardy doesn't necessarily...
okay now.
Okay, very good. So I just thought your appearance was absolutely wonderful, and I like just how personable and charming you were on the episode. But I want to hear about the experience from your side. So can you take us through what it was like to be on Jeopardy and just what the coolest parts were?
Yeah, of course. So the first thing to highlight is what a huge privilege it is just to make it on the show at all. Every year, between 80,000 and 100,000 people take the online test to try to get on the show. Of those people, only 2,500 to 3,000 make it to an in-person audition, and only 400 of those people make it onto the show every year. Getting on is especially precious right now because Alex Trebek has been fighting stage 4 pancreatic cancer for a year now. And you probably know that the prognosis of that disease is not great. So it was especially precious to me to be able to get on the show at all while Alex was on. And then to be one of the last few groups of contestants to tape before things got locked down for coronavirus.
Right.
They haven't taped any episodes since March, and mine taped back in February. So I just feel really lucky. It was a once-in-a-lifetime experience, a bucket list experience. Jeopardy has been my favorite TV show since childhood. There was a time in my childhood when in Minnesota they only aired it at 1 a.m. So I remember really looking forward to tornado alarms, because if we had to get up in the middle of the night, my first thought was, yay, now we can go watch Jeopardy. And ever since I finished my surgical training, I've been trying out every year, or I've been taking the online test every year to try to get on the show. Getting a passing score most years, but this was the first year that I got called to an in-person audition. Cesar and I took a 4.5-hour bus ride to Washington, D.C. for my in-person audition. And there we took another written test, and we stood up and played the game and had fake interviews so they could see our reflexes, our personalities. And then, there were several wrinkles in getting everything scheduled. Like the first time they wanted me to audition, they wanted it to happen during my honeymoon. I said no. I begged for permission, like, please. And so finally I got an audition date a month later. And then the first time they called me to tape in Los Angeles, they called me during a trip I had already planned to Hawaii with my best friend from college. And I said, no, I'm not giving up this trip. And there were people who said, like, Hawaii versus Jeopardy, come on. But, my best friend means a lot to me, and we put together this trip. And I said, like, no. And fortunately, I was able to get another taping date. So the show was taped at Sony Pictures Studios in Culver City, California, part of Los Angeles. The way it works is they tape 5 episodes a day, Tuesday and Wednesday, and they have 12 contestants come each day and go through rehearsals and makeup and taping these commercials that will then air in your local market. And you don't actually know if you're going to go on a given episode until 10 minutes beforehand. So each episode, they would pull 2 names out of a hat to face the returning champion. And so I ended up sitting through the entire Tuesday without going on the show, but I didn't know that. So at first it was good. It was good to watch the show get played over and over so that I could get less nervous and get more psychologically attuned to it. But by Wednesday, when I wasn't picked for the first episode on Wednesday, then I started to get impatient. Like, let's get on there already. And so finally, I was picked to go on the second show that was taped on Wednesday, which became a Tuesday show, Tuesday, April 28th. And it was me and 2 other ladies, the returning champion, a stay-at-home mother with a writing background. I think she has a master's in English, and then the other lady, an elementary school teacher. It was an amazing match. It was a very dramatic match. They provided very strong competition, and the categories that we went through were not my strong suits. I mean, probably my strongest are things like science and literature, poetry, language, food. And then I had brushed up on certain topics that I know they always ask about. So I had studied world geography, I had studied the Bible, and gone through synopses of all the Shakespeare plays and so forth. Judy Cole was very helpful. She was on the show, and she lent me her study notebook that she had used when she competed. So I studied those things, and then it turned out that my categories, a lot of them were things I just didn't know about. And like the airlines category really threw me for a loop. I've only flown to a small handful of countries internationally, so I did not know the names of most of those international airlines, and that was my losing. That's why I lost thousands on that daily double. And so, at the second commercial break, I was in a distant 3rd place. But then I had a strong double jeopardy. I was able to come back. I'm thankful I was able to give my viewers a good show to watch. It would have been very sad if I told everyone to watch my show and then I was in a distant 3rd and I didn't get to compete in final or something like that. Like, at least it wasn't like that. I went into final with 10,000. What was it? I forget the exact number, but it was over $10,000. I was only $600 behind first place, and it all came down to that last question. So even though there's 61 questions that you go through on the show, 30 in single Jeopardy, 30 in double Jeopardy, and the final, it really comes down to the final, unless you have a runaway, which nobody was close to having a runaway. So when I saw that it was 50s films, my heart just sank. Movies have always been my Achilles heel. Like when I go out to pub trivia, my team always moans when it's movies. So I sort of felt very sad right away, and yeah, I guessed the wrong movie. I had no idea. I hadn't seen the film.
For sure, and I totally agree. It was super exciting. You had kind of a comeback in that second half, I guess, double Jeopardy. It was super exciting. I wanted to ask, did we get to see all of your interactions with Alex, or are there additional interactions beyond what we see on TV?
Yeah, so beyond the interview, at the end of the show, he comes up and talks to the contestants while the credits are rolling. And if you stuck around after commercials, you could actually see him talking to us, but you couldn't hear anything because they were running the credits and playing music. And that was, for me, a really entertaining interaction with Alex. He came up to me and he asked, like, what are the latest advances in the field of ear, nose, and throat? And I talked to him about auditory brainstem implants for the deaf. And then he just told me this hilarious anecdote about this commercial that he'd seen for hearing aids. And it was just really great. I find that Alex is really good at thinking on his feet. Another interaction with Alex that you don't see on TV is during the commercial breaks, he actually comes out and talks with the audience. So the audience consists of some guests of the contestants, but it also consists of just tourists who are there to check out a show. and he basically stands out there during commercial breaks taking questions, and it was from those questions that I really got a great glimpse into what an amazing person he is. For instance, they asked him how he was feeling, and he said he feels tired every single day, and that it's kind of a miserable way to go through life. But then when they asked him what he was doing in his spare time, he described some project he was working on this swing set in his backyard. And I was just amazed because, if I were almost 80 years old with stage 4 cancer, I'd be on the couch. I certainly wouldn't be in a suit working and being funny and having an awesome sense of humor. And he didn't have to be talking with the audience during commercial breaks, but he did. So just an amazing person. He really, I came away with a stronger sense of what a legend and a national treasure he is. And I really pray that he stays strong and keeps going. We need him. Jeopardy would not be the same without Alex Trebek.
Totally agreed. And I wanted to say you join a very unique subset of competitive Scrabble players who have appeared on Jeopardy. I want to encourage anybody who's still watching it. I think this is kudos to you and to Dr. Kene. We've still got a really nice audience here with us live. Before we wrap up, I want to say, if anybody is also a Jeopardy fan and a Scrabble fan, we did a previous episode of Naspa Tonight where we covered all, maybe not all, but a great many of the players. We had both Andy Saunders, who runs the Jeopardy fan, and we had Jason Keller, a 9-day winner, on that. So I would encourage people to check that out. You can do that at youtube.com/NASPA Scrabble. You can find all the previous Naspa Tonight episodes. And I want to thank Dr. Mina Lee. Thank you so much for coming on the show, sharing with us your experience and passion and everything else. And just a real pleasure. So thank you very much.
Josh.
All right. And I want to thank everybody for tuning in. I don't know when the next episode of Naspa Tonight is. It's been 5 months since the last one. I don't know what the next one, where the next one holds, but I really appreciate people watching tonight and getting a chance to do this again. I've certainly missed it. Okay. Thanks, Mina. Good night, everybody. And
thank you. Good night.
We will talk to everybody very soon. Bye-bye.